Next presenter is Sithmi Attanayake, and she is going to present on exploring cultural, religions, and legal barriers obstructing access to safe abortion in Sri Lanka. So that's the title of her presentation. And Sithmi holds a BA Honours in Sociology from the University of Peradeniya. As a dedicated youth activist, she has actively engaged with several non-governmental and international organizations in various roles, including volunteer, project coordinator, project consultant, and educator. Her international training in SRHR further inspired her to pursue research in this field. Additionally, she has served as a research assistant at the University of Peradeniya, contributing to a collaborative research project with University of Birmingham and the University of Colombo. So with that, I call Sydney to make her presentation. Over to you, Sydney.
Thank you. Good evening, everyone. So I'm Sanka, and I said I'm a graduate from University of Peradeniya, and I'm lecturing for Royal Institute Gegoda, affiliated with the University of London as a sociologist. My today's topic is exploring cultural, religious, and legal barriers obstructing access to safe abortion in Sri Lanka. So this was actually my final year research. So this is related to it. And so if I talk about the objectives of this research, it is to identify and explore the cultural, religious, and legal determinants that act as a barrier to obstruct accessing for safe abortions in Sri Lanka. So this is the methodology I followed. So if I say I used a qualitative research approach because I didn't want to go into quantitative information because it's about socially constructed determinants. And also I used a purposive sample because I purposely selected my sample within academics, medical professionals, and legal experts, and also activists working in the rest field. So I used semi-structured interviews because I didn't want to use in-depth interviews there because then I will be distracted and I will not follow the proper route. So I was using semi-structured interviews under a proper guidance. And also I use thematic analysis where I can identify proper patterns and different new themes. So going to the results, in short, so I identified there are determinants which are socially constructed that abstracts the abortion access for women, and those determinants act as reasons for barriers. So if we take cultural and religious determinants, so there is a huge influence of cultural and religious beliefs that influence women in accessing safe abortions, especially regarding morals and norms. So for example, if I talk about Buddhism, so one main thing came from the Buddhist participants in the interviews were, so Buddhism, the first precept says killing a living being is a sin. So then for them, abortion or removing the fetus from the mother's womb was a sin because they considered it as a murder, as a killing a living being. So those types of beliefs of people, especially related to the religious ideologies, that kind of hesitated people going into safe abortion. And also the gender roles. So Sri Lanka is a patriarchal society. So patriarchy and family pressure on these women was highly influential for them to decide on not to having a safe abortion, because the reason is most of these decisions made by the wife was kind of influenced by the husbands. So it came from most of my participants saying that even it's the bodily autonomy of the wife, still she had to have the consent from her husband to decide on what kind of sexual decision she should make. Not even for abortions, but even for sexual activities they engaged in, they had to have consent from the husband, and it was completely on husband's decision and approval that it went. So those kinds of reasons, and also the family pressure, because now in our countries, kind of there are a lot of restrictions for women to go into the society and act. That also comes with the family pressure, where family. So for example, if it's now everybody is talking about premarital sexual relationships. So in Sri Lanka, those people will be looked down on if the society get to know that it's a premarital sexual relationship. So then also there's a family pressure coming from the families, like especially about virginity of the girl and all those things before marriage. So then that is also the family pressure coming for women. So they are very scared of going into abortions. Not even going for abortion, but to talk about those things openly is also like kind of they're thinking twice before opening up their mouths to talk about those. And the other one is social. So the social media has a huge influence on this, because you see if someone comments or if someone posts like on social media a meme or a post regarding abortions or regarding sexual health, sexual rights, there'll be so many negative comments coming from the society stigmatizing it and discouraging people to post more and create awareness in the society about that. And lack of proper sexual education is a big issue in the country, because nobody is ready to speak and there's no open forums for anyone to give their ideas to the society. So even in schools, like even my experience, asked teachers skip the lesson, like went faster, like fast forwarded the lesson, and then it was not properly given, like properly educated. I mean, it doesn't have to be about how to do sex or anything, but it can be just the hygiene, the sexual hygiene can be a point of it, and how cultural sensitivities can make people aware of using contraceptives. So even that part, they will not come up in the schools. They just fast forward that lesson. And also my final is the law. So law is the big determinant that obstruct us access to safe abortion in the country, because our legal penal code came in 1883, which was 303 and 307 between all those actions. So then it was during the British colonial period and not have been renovated, or like haven't done any changes to it for these 141 years. So it's what the British people thought we need, but it's not the real thing we need. So unless the mother's life is at risk, safe abortions are not allowed in the country. So there are all these determinants act as barriers, plus the restrictions of the law. So because of this restrictive law, people go into more illegal abortions, which is unsafe, which is given by different like this unqualified professionals. So I found the percentage from the previous researches. 11.7 maternal deaths happened due to these unsafe abortions. And also in Sri Lanka, according to 2016 findings of the Ministry of Health, between 550 to 750 abortions take place illegally in unsafe methods. So that is what is reported. So we don't know how many happens without reporting, without like unreportedly. So it's a huge crisis. I think law plays a major role in the abstracting access for safe abortions in the country. And my conclusion is, again, these cultural, religious and legal determinants create significant barriers to accessing safe abortion services in Sri Lanka. And also these barriers limit reproductive rights and create negative social health outcomes for women. So as I said, when these people don't go into safe abortions, they go into home remedies, or maybe they go into some unsafe method. So if they have enough money to afford, they will go to an unsafe one, but still they won't get the post-abortion care from them. If they doesn't have money, they will go, and if they are ashamed of talking that in front of the society, then they will probably go for some herbal usage or something in order to abort it by herself at home. So that's a home remedy. So then these can cause different, even the unsafe abortion, like going for an unprofessional doctor, will create a lot of consequences, which is negative, could make the mother's life at risk. The woman's life might end up dying. So, and also my recommendations are, so there should be culturally sensitive sex education in school. So culturally sensitive as in it should be all inclusive. It should be inclusive of gender, it should be inclusive of the age, and also the language. So it could be, there are people from speaking different languages, and also the sign language, braille. So those are not being addressed. And there should be proper, rather than just displaying the women's sexual system and then male reproductive, there could be more interactive ways that can be present in these lessons, which is also appropriate to the culture. And the other point is the penal code probably should be amended according to addressing the contemporary social issues such as underage rape cases, because in such instances they would go for an abortion. It's not needed for the mother or the woman. So such cases, I think the law should be liberalized to address those needs of people. And also the economic disparities where they can't afford contraceptives, and ground level initiatives, because it's mostly reported from the rural Sri Lanka where they don't know, they are not aware, and they don't have access to this information. So, and also social media and mass media, rather than discriminating these women and creating all sorts of prejudices about these women who are asking for safe abortion or at least sexual advice, there should be some open space where they can speak up openly. There should be open forums with expertise in the field who can present their ideas and help women free of charge sometimes. So yes, those are my recommendations. And these are some of the previous I referred. Thank you so much.